Oftentimes, parents may attribute pain in a child's foot or ankle as growing pains, but there's actually no such thing.
Any pain that lasts more than a few days or that is severe enough to limit the child's walking should be evaluated, the experts say, by a foot and an ankle surgeon. For this week's edition of Health Connections, Dr. Corey Blackburn joins us now live to answer some questions for us. Dr. Blackburn joins us from Grand Island. Hey, Doc, what are some of the most common foot ailments experienced by kiddos?
There's a few ailments that are common to children. One of the most common that I'm asked about is flat foot deformities. Many children have flat foot deformities that are not painful, but occasionally it causes them to run awkwardly or have pain or trouble fitting in a shoe, and sometimes that's severe enough to need an evaluation.
Doctor, let's talk about, I was just going to say treatments that are available.
Some of the treatments, some of the most easy treatments are changing the shoes or putting an insert in the shoes. Occasionally it requires a little more involved treatment, but most often it's a brace or a shoe insert.
Yeah, sometimes those inserts can really help out for a person with flat feet. Seaver's disease, that really originates, correct me if I'm wrong, in the heel, right?
Right. It's a bit different than heel pain that most adults experience. The Achilles tendon attaches to the back of the heel and it pulls on that growth plate, giving them significant pain. It comes and goes as they grow. It's usually times of most active growth between 8 and 14 years old.
Doctor, let's talk about inflammation of the heel's growth plate. Is that a big problem?
Yeah, it's very painful for a lot of children. Oftentimes in sports, when they're trying to be most active, it gets inflamed and becomes very painful. And then regular activities become very painful. But it occurs most often in sports.
Sure, and as they grow, yeah. And ingrown toenails can be a big issue as well.
I didn't think younger kids could get that.
Yeah, it's very common in children. Tight-fitting shoes, trimming it too shortly or incorrectly can lead to the nail ingrowing, and sometimes it is a thing that runs in families, but it becomes very painful and can, in some cases, become infected.
My goodness.
Dr. Corey Blackburn, thanks so much for being with us over in Grand Island tonight.
Thank you.
I suddenly feel like the worst parent ever. I didn't know kids could get that. Well, they can.
Well, now listen,
now
they can.
Now I'll be on the lookout.
All right.
Finally tonight, NASA's giving us a look at a history-making